All right. Good afternoon, everyone, and happy Black Maternal Health Week. My name is Lakaya Johnson, and I serve as a Senior Health Equity Fellow in the Office of Minority Health and Health Equity. I am so excited to be celebrating with you today, and also excited to welcome you to our panel. We will be discussing supportive birth programs in the state of Oklahoma. So like I said, this is a part of Black Maternal Health Week. We have a slate of really exciting activities that have been planned by OSDH, and you can also follow along with the national activities that are taking place. There's also a Twitter chat happening this afternoon if there are any Twitter users. I believe it starts at 2:30. But I just wanted to start by giving a little bit of background about Black Maternal Health Week. April is also designated as National Minority Health Month, and Black Maternal Health Week is a really important part of that. It's officially recognized by the White House. It was last year, and it takes place every year, April 11th through the 17th. So if you're wondering why we have Black Maternal Health Week or what the purpose of it is, it's really just a week of awareness, of activism, and community building, and it's all aimed at amplifying the voices of Black mamas, bringing visibility to Black-led maternal health initiatives, and centering the values and traditions of the reproductive and birth justice movements. So I'm sure you all are familiar with these statistics related to the national maternal health crisis that we're experiencing in the United States. The CDC reports that approximately 700 women die each year in the United States as a result of pregnancy or delivery related complications. And unfortunately, that rate is exacerbated for Black women. Compared to the total population, there are about 55.3 deaths per 100,000 live births in Black women, compared to, again, 19.1 deaths per 100,000 live births, again, for the total population, which represents a statistic that Black women are 3 to 5 times more likely to have a maternal death than white women in the United States. If you know me, you know that this is not a statistic that I like to repeat often, because we know that that mortality from those leading causes of death are 60 to 70% preventable. And so what that leads me to saying is why? Why are we still having this conversation? Why are we repeating these statistics as if it's something that we should accept, or it's intractable or unchangeable? And that's not the case. And so we're really excited again to talk about supportive birth programs instead of talking about the issues related to some of these factors, again, that influence this negative or deficit-based perspective of what Black maternal health looks like in the United States. So again, I wanted to draw attention to the fact that this event is in conjunction with activities that are taking place across the nation. And the theme is all about building our liberation and how we can center Black moms, families, and systems of care to really shift the narrative about what Black maternal health really is all about, what it looks like, and how we can continue to uplift Black women-led organizations that are really moving the needle by focusing on ways to engage Black women in our communities, and also ensuring that those voices and experiences lead to the systemic change that we really need to see to improve outcomes. So like I said, I work in the Office of Minority Health and Health Equity, and it's really important that we reiterate what our shared goal is. If you're not familiar with the definition of health equity, it's really the attainment of the highest level of health for all people. The definition of birth equity is really focused on assuring the conditions for optimal births for all people, with a willingness to address racial and social inequities in a sustained effort. So it's not just a one and done, but it's really thinking about how we can engage every aspect of this really complex system to improve outcomes. And another thing that we really focus on if we're talking about birth equity and birth justice is the fact that race, ethnicity, geography, income, ability, sexual orientation, gender identity, immigration status, or any other identity, whether alone or looked at in combination from an intersectionality kind of approach, it should never stand in the way of equitable health outcomes and birth outcomes specifically. So again, I'm really excited to talk with our panelists today about some community solutions that are really being implemented in the state of Oklahoma to achieve birth justice that don't just look at pregnancy, but look at this full spectrum, this full continuum of pregnancy and interconception care. I mean, it's important that we advance community solutions, because if we really want to create transformational systems level change, it's going to require a comprehensive approach that really addresses, again, Black maternal health across the life course. So all of the panelists that we've invited today are implementing some really, really phenomenal programs that are increasing the community's collective capacity to care for and support Black birthing individuals, again, across this life course. So over the next 30 minutes or so, you'll have the opportunity to hear more about the Tulsa Birth Equity Initiative, the Intune Mother Society, and Beehive Birth Consulting, and another organization called For the Village. So with that being said, I would like to introduce our first speaker, and that is Mrs. Rashonda LeGrand. So Rashonda LeGrand is uplifting access to holistic family planning for historically excluded communities in the US and internationally, with a focus on environment, education, employment, economics, and empowerment. She serves birthing families as a birth coach, a breastfeeding educator, a postpartum care provider, a comfort measure specialist, and a behavioral health and wellness coach. She's the founder of the Intune Mother Society, a 501c3 nonprofit with a focus on community-based perinatal healthcare and workforce innovation through a healing justice framework. She leads a team of local birth work providers through Beehive Birth Consulting Agency, her private practice, which focuses on providing holistic family planning services and education to priority populations in central Oklahoma County and surrounding areas. Rashonda currently serves on the board of the Birth Future Foundation, which is an organization focused on racial justice and equity in midwifery. And she's a student of anthropology and biocultural human development, neurolinguistics, and sustainability. She also derives her expertise from her personal experience, her spiritual awareness, and her cultural background. She's a wife of 15 years and a home birth mother of 4 boys, and she's proudly homeschooling her children. She spends her free time writing poetry, listening to music, and working on her forthcoming book, Womb Snatchers, which is an ethnographic fiction about the future of what she calls reproductive consciousness. So I'm really excited to turn the stage over to Mrs. LeGrand, who's going to talk to us more about the Intune Mother Society and Beehive Birth Consulting. So I'm going to stop sharing my screen and start sharing hers. So give me 1 second. Alrighty, and I can advance the slides whenever you would like me to.
All right, well, thank you so much for that lovely intro. And I'm so glad to be here on today. And today is a double special day for me. One, this time last year, my father, he unexpectedly transitioned right when the Black Maternal Health Week was taken off, and I didn't get to participate. So this year, I'm excited about being able to be in alignment and present for this opportunity. As she mentioned, my name is Rashonda LeGrand, and I'm the founder of the Intune Mother Society. And today we're going to talk about sustainable liberation for Black Maternal Health Week. Our goal and our mission is to shift the paradigm for the way that we show up and the way that we build capacity for maternal health through community-based care. Next slide, please. Being here today lets me know that we have a common agenda. And in that common agenda, we are looking towards the future of being able to implement maternal health care solutions. As mentioned earlier in the introductions, the narrative around Black maternal health has been really pressed, and we want to make sure that we create space for a narrative that tells a new story, and that new story happens to come from us being able to work together to build common solutions. So throughout this presentation, I'm going to give you a little bit about who I am and how I got involved in this work, the information about our organization, the Into Mother Society, and our company, Beehive Birth Consulting, what resources and services we provide, and how to learn more and ways to support our work. Next slide, please. When I first started out as an anthropology student, I attend Oregon State University, which is really an awkward way that I got there, through working with the organization mentioned in my bio, Birth Future Foundation. We used to be the board of FAM, which is Foundation for Advanced Midwifery. And we decided that, because we were having issues within the organization, to really facilitate space for birth equity, for, Black movement and liberation, it was a lot of pushback for us to make initiatives take place that uplifted the work of Black and Indigenous practitioners, right? Specifically in the midwifery community. And so I ended up meeting a very lovely woman by the name of Missy Cheney, who's a great researcher and professor at Oregon State. And I talked to her about my vision and mission for this work. And she kind of recruited me as a student of Oregon State. And when she recruited me, she gave me this bold statement by Michael Liu, which is, we can't all be created equal if we can't get an equal start in life. And that stuck with me. And that's kind of like the framework that I use when doing this work. And so I wanted to just make sure I acknowledge that part. Next slide, please. As mentioned earlier, I'm the visionary of this work. This is my baby. I have 4 boys, and this is the last baby that I'll be giving birth to, that I hope grows old and that really sustains, the work that I'm doing for the legacy that I hope to leave, to bring better healthcare options and better capacity to seed, grow, and nurture humans throughout the primal continuum. I'm the founder of this organization and the owner of Beehive Birth Consulting Agency. I began this work as a mother. I experienced such a beautiful birth with my first son that the midwife, I remember going up to my room after giving birth and saying, I think I want to become a midwife, because if this is what you do, if this is how you make women feel, in childbirth, when I come from a family who was riddled with a lot of fear and a lot of, negative stereotypes and ideas around what the birth practice or art looks like, it made me really understand that it doesn't have to be what those stories are, and it's based upon what your own beliefs are. And so that experience began my work, and it really pushed me into this liberated birth movement. And from there, I started to use the power of my influence and storytelling in the world of public health, working with clinicians and researchers to create a pathway to provide community-based perinatal healthcare options for all childbearing families. Next slide, please. Who are we? The Into Mother Society is paving the way for innovation in community-based family planning. Most of the time when individuals are doing this work and they're focused in on providing birth support services, we all know the terms of, breastfeeding educators and lactation consultants, midwives, and doulas, but we wanted to be able to expand and look at the idea of how our organization, as a charitable health organization here in Oklahoma that is focused on long-term approaches, could really address the social and economical structures that could promote a more ecological approach, right? That we could really identify how important it is to look at the primal continuum of reproductive well-being and to address that from a community-based perspective. And so we started to really look at the trajectory of what that looks like as far as communication and influence in the childbearing community and to providers alike. So our program fosters space for research and community services, education and workforce innovation, utilizing the family planning lens, where most of the time you don't see midwifery and doula support or breastfeeding support through family planning channels and circuits of care. And so our organization uses a non-exhaustive framework to build solidarity for anti-racism and healing justice practices, for assessing the state and impact of access to sustainable techniques and foundational resources for understanding the simple solutions on a grassroots level, while also impacting health outcomes for Black teens, women, and families. And we utilize this framework so that we can make sure that we're not only uplifting Black mamas, Black, families, Black providers, but also Black systems of care. Next slide, please. We do this service innovation through our partner and company, which is our sustainability partner, Beehive Birth Consulting. And we practice at a location that centers technology-based education. And when I use the word technology, I use the word TEK, or the acronym TEK, for traditional ecological knowledge. A lot of times when we do this work, we're doing this work from evidence-based or technocratic medicine that leaves out the cultural and spiritual context around birth work and practices and birth justice. And we want to be able to expand and complement those services by also giving our community the opportunity to use technology-based services through preconception education, pregnancy support, breastfeeding, postpartum care, and mental health, so that we have a better structure for overall reproductive well-being. And through this, we're redesigning community-based experiences, and we're redesigning them by using non-medical practices that provides educational pathways for reproductive well-being of these individuals that look like us, or that look like myself, from historically excluded communities. In doing so, we're streamlining relationships for resources and equity. By creating these community-based programs, we're able to offer more options for equitable relationships and culturally centered care that complements the medical model. A lot of times people assume that when you're independent or you're providing holistic care, that it can't be integrative and complementary, because, we like to think about these things in letters, and degrees, when a lot of times we forfeit the opportunity to work with community-based structures of care that can really help to identify other issues and have more intimacy and time, so that when they do get to medically based care providers, it's ease for them. So our work that we do is based upon being complementary, so that we can maximize the access through technology. And the utilizing of this technology-based resources expands the traditional ecological knowledge while uplifting the practices that reclaim, reduce, and restore our overall reproductive well-being for Black teens, women, and families. Next slide. So we want to reimagine the way that maternal health care is provided. And so the way that we look at this framework is that we integrate the family planning approach with a vision for improving the social determinants of health of Black childbearing families. According to research, community-based healthcare models offer complementary solutions to standard systems of care. A lot of times when we build relationships from our organizational standpoint, we always, hear the term like, we have to be able to look at the social determinants of health, but we don't see the fact that sometimes working within organizational institutional structures, the individuals are not representative of the people that they want to serve or that targeted population. So we reimagine a system of care that does target to train, to recruit, train, certify, employ, and repeat that process for individuals who are in the community, people who are trusted community members, and people who are looking for new career paths to be able to support the infrastructure and the capacity to be able to innovate a system of care that continues to bring an integrated approach to care for replication and for healing justice, that is a tool and a framework for us to be able to really understand what it means to sustainably liberate our community from oppressive behaviors, racist attitudes, and other, oppressive ideas and identities around our capacity to be able to serve ourselves. And so what we end up seeing a lot of times is that organizations and institutions are well-meaning and they want to support, but the representation and the actual context of how to serve is not really right on. And so we want to be able to say, you know what, if we train the individuals who are in the community who are having the most, the poorest outcomes, then we'll see a difference, because representation does matter. And so that's the way that we've reimagined being able to look at maternal health from a new lens. Next slide, please. So we're always open to partner for impact, right? And we have an actual campaign that's going on right now. You can follow the link that you see there on the screen. And it's about respecting the process of human development. And how can we strengthen and improve the reproductive well-being and experiences of Black childbearing families, if we're not really identifying those in the community who can be of that service and that provision. And so we are focused in on really building partnerships and relationships with organizations and institutions and individuals, who are invested in community-based care, and looking at this from a lens that's futuristic, that says that communities shape communities. So when the community comes together to do the work, the community improves. And that's the impact that we want to see, is the improvements. Next slide. And so we welcome you to stay in tune. We have our websites, timcenter.org and beehivebirth.com, and you can check us out or send us an email if you have more information. We are headquartered and located in Midwest City. And we actually just took on another space that's right next door to where we are, that is going to be our new teaching facility. So now we have more space, and that's another reason why you want to contribute to the work that we're doing, so that we can really uplift our vocational support services and build more capacity in the community in the state of Oklahoma, throughout Central Oklahoma, to build a workforce initiative that supports Black and Indigenous people of color and families and allies to be able to experience reproductive health with a new lens. And thank you so much. I appreciate your time.
Oh my gosh. Oh my gosh. That's all I can say. This is just so exciting to me, and I mean that sincerely. I know you all probably have a lot of questions, and so I would just again remind you to write them down. We'll have some time for Q&A at the end. But thank you so much for sharing just your work and your vision. It really is incredible. And the one thing I will say is that no part of this is a small feat. And so it was described really nicely and really simply, but no part of what you just described in the systems change that you are you've initiated and that you're working to affect is easy. So I just want to publicly acknowledge that. So again, if you guys have questions, please be sure to write them down. We'll have some time at the end. But I'm excited to introduce you all to our next panelist. So our next panelist is Labrisa Williams, and Labrisa actually serves as the Executive Director of the Tulsa Birth Equity Initiative. And as a leader of the Tulsa Birth Equity Initiative team, Labrisa drives innovation to ensure families in Tulsa are equipped to have healthy births with dignity. She's a Tulsa native who earned her BS from the University of Oklahoma before joining TBEI. Labrisa actually worked in teen pregnancy prevention for 3 years, and she also served as a Peace Corps volunteer in Botswana, focusing on HIV prevention and capacity building. She's a 2021 Aspen Institute Healthy Communities Fellow, and she's deeply passionate about addressing health disparities within communities of color. And she loves spending time with her family and her 3 nephews. So, Labrisa, I'm so happy to have you here. I will stop sharing so that you can share your screen. I know you have some slides to share with us. Was Rhiannon able to make you a co-host?
I think she's going to share for me. I only have about 3 slides to share, so you'll mostly be hearing from me. And I went ahead and took out the slides that talk about the data. We already talked about the data. We already know about the inequities that exist in maternal health, so I don't want to talk about those things. Really want to cover the supports that we can provide to families. And so that's what I'll be talking about today. So glad to be here. Thank you for the invite and for having me. My name is Labrisa Williams, and I am a native of Tulsa, and I've been doing public health work since 2009 as a high school student. I started off as a sexual health educator for my peers, and the common thread in all of my public health experiences has been inequities and access. So as a Peace Corps volunteer, had lots of free time over in Botswana. I served in a small village of about 5,000 people, and learned, and I was based at a clinic, and I learned and observed a lot of maternity care that took place without interventions, without providers being present, and really just became very interested in how birth looked different in other countries, and started to learn more about the inequities in maternal health in a developed country like the US. I am a sister to 3 Black women, 2 of which have experienced pregnancy and childbirth. I'm a daughter, I'm an auntie to 3 precious boys, 9 years old, 2 years old, and an 8-month-old baby. And in the next 9 weeks, expecting a new nephew, so another newborn baby as well. And so I've experienced childbirth and pregnancy as I support those who matter to me the most, my family. And so I want to share a little bit about the work that we're doing at the Tulsa Birth Equity Initiative in supporting families and equipping families here in Tulsa to have healthy births with dignity and reduce maternal health disparities. At TBEI, we envision a Tulsa in which all people are centered before, during, and after pregnancy, and our work would not be possible without our team. So I wanted to make sure that I shared who is on our team, because the work that we do would not be possible without these individuals of doulas, of community health workers, of hospital quality improvement officers, to really move forward the mission and vision of the work that we do. We know all the inequities that exist. I know it's Black Maternal Health Week, so I know I've been on plenty of panels and webinars that talks about the statistics, the poor maternal health outcomes, and ways that we can address these inequities. And I know that it takes a multifaceted approach and a collaborative approach when we think about the inequities that exist. And so wanted to share about the programs of TBEI and how we work across the spectrum from individual to community to policy in these 6 main branches of TBEI. Next slide, please. So we have 6 components of the work that we do. Our flagship program, oh, sorry, you can skip to the one. It should be like 6 different components. It should be right. Yep, that's the one. Our flagship program is our community-based doula program, where we provide direct services to families, and we actually train people to be doulas here in Tulsa. And so we prioritize historically marginalized groups and populations, and we have 4 full-time doulas on our team that provide free doula services in a home visitation setting. Our community-based doulas provide culturally congruent doula services to families, and we employ doulas of and from the communities they serve to ensure that families are seen and heard before, during, and after pregnancy. And what that really looks like, right? We can talk about community-based doula programs, culturally congruent services, being of and from community. I want to share just a quick example or story of how we employ people of and from communities that they provide doula services to. So one of our full-time doulas, Mariana, she was a teen parent, and she actually graduated from one of the programs here through TPS, Tulsa Public School District, called Strong Tomorrows. Strong Tomorrows is a program embedded within the public school system that has case managers that supports expectant and parenting teen parents to really support them through high school and to get them through graduation and parenting. So lots of parenting support. And so Mariana was actually a part of that program called Strong Tomorrows. And so she's an alum. And now a lot of the referrals that we receive through our doula program can be from Strong Tomorrows and from teen parents who are wanting doula support. And so Mariana now provides doula support to teen parents that are navigating parenting, pregnancy, in those teenage years as she once was. And so it's really about employing folks who have some shared lived experience where they have some foundational connecting factor to build relationship, to build rapport, in order to really have that trusted relationship between the doula and the family. And then we have Queens Village. So Queens Village is a fairly new program, and we're a replication Queens Village site. So we're Queens Village Tulsa, and we're a part of a year-long learning cohort out of Cincinnati. It was Queens Village, Cincinnati. And Queens Village is really a program where we create organic relationships with community, addressing community needs, and it's a safe space for Black women. And so Queens Village is specifically for Black women, and we bring awareness to the health disparities, but we also provide support. So some of the most recent things that we've done, we did a vision boards soiree. We had a movie night under the stars where we watched the photograph. A lot of what we've started off doing is community building. And so I think most of us may be familiar with weathering or chronic stress and how that impacts pregnancy and childbirth. And so wanting to make sure that we have communities of Black women where we can come together, be supported, relieve stress, and really talk through the microaggressions, the systemic racism, implicit bias that we have experienced so that we can have better birthing outcomes. And so Queens Village is really just a space for Black women to gather. This week during Black Maternal Health Week, we'll be over at Fulton Street Books and Coffee, where we're going to be talking about how to make sure our libraries are inclusive for our children and the messages that we want to share and pass down to our children. And so it's really about building community within Queens Village to uplift, support, protect, celebrate Black women and their families. And then we have our preconception group care program is where we're actually just getting started in this. So it's actually coming soon in partnership with OU and Dr. Saisha Dennis over at OU. We just found that there was not a lot of resources and support for people who want to become pregnant. And so preconception group care is really about people who want to become pregnant within a year and are navigating some chronic condition before becoming pregnant, like hypertension, diabetes, and us really supporting them in navigating that condition, whether it is adherence to medication, whether it is talking through self-advocacy, and really supporting them through that so that they can have a healthier birth outcome. And then hospital quality improvement, where we are working with local hospitals too, here in Tulsa, OSU, and Hillcrest, and really supporting them to implement quality improvement projects and models to really improve outcomes, whether that is seeing a decrease in elective cesareans, maternal hemorrhage, but really supporting them and identifying the gaps when we think about labor and delivery, so we can see improvements in maternal health outcomes. And so right now we're doing a lot around bridging community with clinicians. We've heard a lot from community around, I've never seen my provider in the community that I live. The only time I see them is at the hospital system in clinical clothes, and we don't have relationships. And we know that a big part of building trust is through relationship. And so really thinking through how do we bridge and help rebuild trust that has been lost within the medical system. And so really doing a lot of work with those two specific hospitals to really address gaps in maternal health and in labor and delivery so that we can see better outcomes when we think about not just when we think about systemic change, right? And so from this list, you can kind of see the community-based doula program is more direct service. How do we make sure that families are seen, heard, valued, experience trauma-free, healthy, dignified births? And then we're moving to hospital quality improvement. How do we look at the practices that are embedded within the systems that do not lead to positive maternal health outcomes or improved maternal health outcomes. And then our community outreach and awareness is really where we're just increasing awareness of maternal health issues at large and the services that we provide to support families. And then policy and data is the systemic change that we want to see more long-term sustainable improvements in maternal health. Our doula program is great. It's our flagship. It's our most robust program, but we know that doulas are not the end all be all, and they will not be the ones to solve the inequities that we're seeing in maternal health. And so the policy and data piece is super important when we think about long-term sustainable change. And we do have some policy priorities that we're working towards when we think about advocating for policies to improve maternal health. Some of the ones that I can think of are about doula reimbursement. So wanting to make sure that birthing people, birth workers are compensated for the services that they're providing to families. Postpartum extension for moms past 60 days postpartum. A lot of times postpartum depression symptoms do not show up until 1 week up to a year postpartum. And if moms do not have coverage past 60 days, how do they seek treatment and receive mental health supports? And so we know that policy is super important when we think about improving the maternal health inequities that we see today. And then I was on a webinar this week, lots of good stuff going on locally and nationally around Black Maternal Health Week. And on the webinar, somebody mentioned that we don't talk about the positive narratives a lot, right? We hear a lot about the poor birthing experiences, the traumatic births that have happened, what went wrong, but we don't take a lot of time to highlight the success stories, the beautiful birth stories that have taken place. And so I wanted to share a story of a family that we served through TBEI and supported them throughout their pregnancy, childbirth, and then during postpartum care up to 3 months. And so the family ended up having an emergency C-section, which was not a part of their birth plan. And after the labor and delivery, our team of doulas, they review and reflect on every birthing experience that they support families in. And so the doula that was supporting this family was really nervous because she knew that they did not want to have a C-section, and she felt like she had really failed the family. And so the doula talked through the birth experience with the family, and to her surprise, they were not unhappy, and they had a lot of gratitude for the doula and expressed that they felt prepared because of the support and the education from their doula. And so they said that they were prepared for the unexpected. And while it's not what they had hoped for, they felt supported and understood the medical interventions that were being presented to them in order to make informed decisions. And so although, we can talk about birth plans and things going in the way that we want them to go, we know that those are just that, they're plans, and that if we prepare people and support families, they can still have healthy, dignified, and trauma-free births, because the decisions of the decision making is left up to them, right? We're saying these are the options. What do you want to do? And then give them time to think about that and to process what that means. And so I like sharing this story because the doula was like, I mean, if y'all could have seen the doula, she was really worried, like, oh, I don't even want to review the birth. I feel like I really felt this family. And the family was like, we love you. We have nothing but gratitude for the support that you have provided us. And you really have prepared us for what we otherwise would have not been prepared to experience, which was this medical emergency C-section. And so that's just a little bit that I'll leave with you all. And I just want to share too, people can learn more about our work at tulsabei.org. And can support our work by sharing our resources. You can like and follow us on Facebook and Instagram. And if you would like to donate to support the continuation of the work that we do, we also have a donation link on our website. And that's what I've prepared for you all today, the work that we do at the Tulsa Birth Equity Initiative.
Thank you so much. And I'm beaming because, again, it is so incredible to hear about, again, the positive aspect of this work. So we have some questions coming already. I'm not going to look at them because I'm really excited to get to the Q&A portion. We have one more community-based organization to actually tell you all about this afternoon. And that is a really awesome organization called For the Village. Unfortunately, well, it's fortunate, I think, I'm giddy about it. The executive director, Farah Antoine Mayberry, was unable to attend the panel this afternoon because she's actually attending a birth. But I still want to give you guys an opportunity to learn more about Farah, and I will be presenting just a few of the slides that she shared. and telling you more about the organization. So Farah Antoine Mayberry is a wonderful person. I hope all of you get an opportunity to meet her one day. But she graduated from Howard University with a degree in occupational therapy, and she's worked as an OT in various adult and pediatric settings, including in the NICU. Her passion for the perinatal population led her to become an internationally board certified lactation consultant, or IBCLC, a doula, as well as a midwife's assistant. She started her own practice, which is called Epiphany Birth Services. And she also founded, and she currently serves as the executive director of an organization called For the Village Incorporated. So For the Village is a nonprofit that is really passionate about impacting Black infant and maternal health in Oklahoma. For the Village primarily trains community-based birth workers, again, that reflect the community that we hope to serve. She looks forward to doing her part to help enhancing infant and maternal health in the Black community. And she and her husband are proud parents of 5 children. And I get to say we when we talk about that, because in addition to, being a population health and system scientist and a state health equity advocate, I also am in training to become a full spectrum doula. So, and I'm training to be a community-based doula through For the Village. So it's an organization that really means a lot to me. So I'm going to skip ahead a little bit in her slides, just to share a little bit about the purpose of For the Village. So For the Village, like I said, is a nonprofit organization that really is committed to enhancing infant and maternal health outcomes in the population that experiences the highest rates of infant and maternal mortality using an evidence-based approach. And that's really important. You heard both of our previous presenters talk about the fact that, we're not anti-establishment. We aren't anti-evidence. We are looking to implement evidence-based interventions to really inform and influence the outcomes that we're seeing. So you might be surprised that you're already familiar with a lot of evidence-based perinatal interventions that For the Village trains birth workers to actually implement. And those are in the areas of breastfeeding, childbirth education, the provision of doula care and services, and then also thinking about access and trust. So all of these are evidence-based opportunities to improve perinatal outcomes. And so what I realized as we were talking is that we didn't necessarily define what a doula is, and I apologize for that. I could have included that in the introduction. And it's been so awesome to get to have conversations with friends and family about what a doula is. And I'm sure you all will have questions for our panelists once we wrap up too, because we really are working to shift the narrative about these birth support systems. And it's really about village-based care. And you all saw that in both of the previous presentations and also in this one, we aren't just talking about birth. This is a holistic kind of approach to every aspect of this process. But a definition of doulas that I personally really like a lot just talks about the fact that doulas provide emotional, informational, spiritual, and physical support. And it's not only to the laboring person, but also to the family. So doulas, there are doulas that provide care during the preconception process, throughout the birth and your pregnancy and delivery process, but also postpartum. There are doulas that actually help in the event of infant loss as well. And so when you think about a doula, you also should think about the root word, which is a support. So For the Village specifically looks at, I would say it looks primarily at issues related to access to doula care, but also with influencing and building the workforce, the doula workforce. So we do that primarily by developing birth workers. And it's really a very special, it's a really special opportunity, because at the end of our training, we're full spectrum birth workers, which means we're certified birth and postpartum doulas, childbirth educators, lactation professionals, as well as sexual health and reproductive counselors. In terms of the provision of those birth services, we're community-based doulas, meaning none of the parents or families that we serve actually have to pay for any of the service that we provide. And the same is true at TBEI. And another really cool component of For the Village is that we actually raise money to ensure that the doulas that are providing the services are not just paid a living wage, but a thriving wage. So a big part of that is policy advocacy work to ensure that birth workers across the state have access to being able to provide this really important care that is not always accessible to all families. And according to the mission of For the Village, especially thinking about the families that need that support. So before we transition into the Q&A section, I just wanted to share these really cool collages that were created to actually demonstrate the 2 cohorts that we've had with For the Village. So the first cohort actually went through the program last year, and we had 4 birth workers. And the second one, there are actually 6 of us. And so we're really, really excited about being able to contribute to, again, shifting the narrative in the state of Oklahoma. And if you think about, again, we've heard about 3 programs in the state. That's not nearly enough to meet the need. And so I hope that that's definitely something that you all took away from this. So there are lots of ways to get involved or to support the work of For the Village. One, we have a lot of committees if you're interested in being involved in the work. Another important way that you can assist the organization is by connecting us with other entities that might be interested in supporting our work. Making a financial contribution. And I'm jumping ahead, but y'all, this is not often work that is that's funded through state or federal programs. There's a lot of private donation and philanthropic or donation that's provided through philanthropic organizations that ensures that we're able to do this work in the community. We host a lot of community-based events, so sponsoring space, food, or services for those events, participating in campaigns that we have, raising awareness about the work that we're doing, and lastly, just being creative and thinking about ways that you might be aware of to contribute. And with that being said, I will stop sharing this screen and we can open the floor for questions. All of the screens, guys, this is a lot. So I want to start again just by saying thank you to Rashonda and Labrisa for sharing information about your organizations. I really, really, really appreciated that. I am going to try to can you spotlight multiple videos? I don't know. I think there are a few enough of us that we can see each other's responses. But I'll get us kicked off with a question from the audience. And again, if anyone else has questions, feel free to go ahead and share them in the chat. But the first question is, how would you encourage community-based birth support programs to engage within the hospital system? So that's a really great question. Who would like to start?
I can get us started. So I would encourage collaboration. And so what we do at TBEI, we actually host nurse doula roundtables. We meet with the family medicine residents and the doulas and clinicians build relationship. So I think a lot of times people have this perception that doulas are the muscle, and we're really debunking that myth and that misconception, and knowing that everybody that's a part of this birthing team is working in conjunction for one common goal, and it's to support this family and having a healthy birth experience with hopefully the outcome being healthy baby and healthy mom. And so we actually engage in conversations with providers, with hospitals. I mean, we send flyers with the faces of our doulas so that they're familiar with the doulas that are employed by the Tulsa Birth Equity Initiative. And we really just built relationship and rapport with those clinicians and those providers. And we do that through like really honest dialogue. So this is not, we go and we have presentations about what a doula is, but at the last nurse doula roundtable, some of the nurses were saying that they had doulas who would come and sleep. And we're like, were those our so we're also having like difficult conversations about expectations around how they expect doulas to show up. What does that communication need to look like? And a lot of positive stories too around how supportive doulas have been when they weren't able to support families in the same way because of the relationship that the doula had with the family. And so we're really leaning in to those relationships. At hospital.
Oh, I think we lost you, Labrisa. I'm not sure if her call dropped. If it comes back, hopefully you'll be able to run back the last part of that. Rashonda, I'm really interested in hearing your response to this question, especially given that you operate a birthing center.
Well, just to be clear, we don't have a birthing center. So we have this a family planning center, right? So where we do a lot of work that is similar to what the other organizations here talked about today. Um, and the center that we have that we're expanding is our VOTEC center. So it's to expand our training capacity. But I think that one of the major ways for community-based organizations and hospitals to work together or institutions to work together is to really look at creating space for asking the community how they want to be served. And it was great for LaBresa to mention like doing the nurse, and doula roundtables. One of the things that we've been doing is we've been talking with OU Health and Sciences Center here locally in Oklahoma City to discuss ways that we can create wellness committees, that look at the way that we're showing up, on a community level, being a bridge of solidarity for those who are in the medical, establishment, so that, a lot of times physicians have burnout, nurses have burnout, especially right now, with all the other things going on in the world. So we want to make sure that we're creating relationships, and it takes time. It's not going to be something that's done overnight, but just being able to have those conversations and talk through those hard points and being able to identify really what are the roles of these providers that are community-based and how do they show up and support the roles of those in the medical establishment.
Yeah, and what I would add to that is that there's definitely a lot of change happening in this industry. And Labrisa didn't have an opportunity to mention it because TVEI has done so much awesome work, but there are also a lot of, I would say, interventions that are being tested within hospital settings to really think about ways that we can optimize the engagement of community-based birth support into these systems. And so I know that another challenge, especially and during COVID, has been thinking about rules related to visitation policies, thinking about COVID vaccination status for birth support, whether or not a hospital sees birth support persons as a visitor. And so there are a lot of ways that we can optimize that relationship. And I think the biggest thing is that it's a relationship. And Labrisa hit the nail on the head when she said, we are all in this together, and our goal is healthy outcomes or healthful outcomes for moms and babies. So the next question is from Andrea Bryant. And the question is, what are some of the requirements to be a doula? And I'll let both of you answer first, since both of your organizations have continuing education opportunities for birth support persons.
So with our organization, it's a simple application process because we do also work with the Oklahoma Works. So our program is sponsored through the Oklahoma Works Department for Central Oklahoma Residents. Our program is a year-long program. And through that program, they provide tuition assistance and things of that nature. So you basically just apply, and we just ask for you to complete the application. And once the application process is complete, there's an interview process. And then after that interviewing process, whether or not, you feel like our program is a good fit for you or vice versa, then we proceed from there. So it's pretty simple.
Process is pretty similar. We host informational sessions for people to come and learn more, to make sure that it's something that they're interested in, because it is a commitment. And we really want people who are committed and passionate about serving their community, but also communities that are experiencing inequities and disparities. And so we host informational sessions. Our training is a 20-week session or a 20-week training course where we meet once a week. And so it includes observation requirements, journaling, homework. And right now we are doing a hybrid or a dual hybrid model. We're transitioning fully back in person, but we did make some accommodations due to COVID-19. But there's no prereq. We do ask for people to not have ever be trained as a doula, because our model is very, how can I put this? It can be confusing for somebody who's went through a doula training and then wants to come and learn about a community-based doula model. And so we don't want people to have to unlearn or undo some of the things that they've already learned to learn about how to be a community-based doula. And that's really around the encounters, the visits. And so our model is really based on relationship. And so prenatally, our full-time doulas provide services once a week prenatally. And so there's a lot of interaction, a lot of encounters with families and folks who may not have went through the training in the same type of consistency or manner may not be used to those type of encounters. And so we try to model what it looks like during the training. So we meet once a week. So that's the same as what you would be doing with families. Prenatally, you would be meeting them once a week. And so the model, we just ask for people not to have been trained previously as a doula, not to have been a part of a train the trainers, to train people as doulas. And yeah, we prefer people who are not currently practicing doula work. And if they are, we want to know, why are they interested in this specific training and what do they hope to gain from additional training as a doula? And so pretty open and really prioritizing people who want to serve people of color and from historically marginalized communities. And then our training is free, and we also provide people with stipends. We know gas has increased, and so want to make sure that we are making sure that the training is accessible for people. If they have children, we provide childcare at our trainings, and really want people to not have to navigate different barriers to become trained as a community-based doula.
And Report the Village is really similar. It's actually a 3-year program, and it's because a big component of it is focused on entrepreneurship and ensuring that you are working with families for 3 years consecutively, and then you are your own, you have your own business established, and then you join our Black Doula Collective in Oklahoma City, which is pretty exciting. So we're at time, but I would like to ask both of you one more question. And that's just, what's one thing that you hope participants take away from this session and that they share with their friends and family?
I would hope that people take away hope, that there are lots of programs, resources, supports that individuals and organizations have created to support families, and that we want to see improved maternal health outcomes, and we want to support families. And so there are resources available for families to access. And so really want them to take that away and really share it with people that they know that could benefit from these services and supports.
Likewise, I think that, the major thing I would like for people to take away is that the community is showing up, and that when you make requests and things like that, then there's an easier way for us to mitigate and create solutions to change those narratives. And that, it's just a step away from asking for support because we're here. And that's what I hope that people take away, is the acknowledgement that we do have individuals in the communities supporting the community in this way.
I would say my mic drop moment is that every person deserves doula support and should have access to doula support. And the work that the 3 organizations that you learned about today, we are barely scratching the surface. There's more than enough room at the table, and there's lots of opportunity for the State Department of Health and also for county health departments to support the work that these organizations are doing as well. With that being said, I will express my sincere gratitude to both Rashonda and Labrisa for joining us this afternoon and really enhancing awareness about all of the great work that's taking place across the state of Oklahoma. And I sincerely appreciate all of you for spending an hour with us. So I hope you get to check out some more of the events for Black Maternal Health Week in Oklahoma, and that you share, again, the message of hope that we share with you all today. With that being said, I will release you to go back to your Wednesday, and I hope you have a great rest of your day. Thank you.
Thank you all.
Thank you.